So last 2 slides are about how do you approach a baby with bleeding. So our first investigation will be, of course, a complete blood count with peripheral smear and PT, APTT we will do. These are the first few tests. So these, otherwise you can call it as a screening test. So you have done a complete blood count and peripheral smear, and you have seen giant platelets or very small platelets. Giant platelets, then definitely think of Bernard-Salyer syndrome, and even in ITP there can be giant platelets. Okay, 2 differentials for giant platelets. Next, microthrombocytopenias. So the platelets are very small in size. Think of Wiskott-Aldrich syndrome, which is the inherited immunodeficiency syndrome. Next, you have done a PT, APTT as well. So platelet is less, there is thrombocytopenia, and PT, APTT are also deranged, that is PT, APTT are also high. Then you have to think of, in a sick newborn, think of DIC and sepsis. If only there is thrombocytopenia but PT, APTT are normal, think of ITP, think of an occult infection, think of a bone marrow hypoplasia. So the platelets are not being produced, so there is decreased production, and thrombosis. So it can be renal vein thrombosis, etc. So this is how you will go in this algorithm where there is thrombocytopenia and coagulation factors. If there is no thrombocytopenia and you have done a PT and APTT, no thrombocytopenia with coagulation factor abnormalities, you see which is abnormal. PT is abnormal or APTT is abnormal. If PT, that is prothrombin time alone, is abnormal, it is early liver disease, because in the late stages both PT and APTT will be abnormal. So early liver disease, PT will be abnormal. Factor 7 deficiency and warfarin administration will cause PT and INR abnormality alone will be present. If PT is normal but APTT is abnormal, then definitely think of coagulation factor abnormalities, hemophilias and von Willebrand disease. So abnormal APTT is hemophilia and von Willebrand disease. If all the PT, APTT, INR all are deranged, then of course DIC will come into picture. Liver disease, DIC will have thrombocytopenia also. Sometimes in case you don't get thrombocytopenia, still think of DIC. Liver disease, of course, once established liver disease, PT, APTT, INR, everything will be prolonged. And vitamin K deficiency also, because 2, 7, 9 and 10, all the factors are abnormal. It will cause both PT, APTT derangement. And if there is no thrombocytopenia and the coagulation studies are also normal. Coagulation studies means the screening only. PT, APTT, INR. The full coagulation profile we have not done. So with the screening, what all you should think? No thrombocytopenia, no PT, APTT abnormality. So everything is normal for now. You will have to think of von Willebrand disease, factor 13 deficiency, qualitative platelet abnormalities, that is platelet function disorders, and vascular disorders like factor 13 deficiencies and vascular fragility, etc. This is a rare disease, like mostly we usually see these, right? Either with thrombocytopenia or coagulation factor abnormalities. When everything is normal, you will have to consider these disorders.